Top 5 Tech Trends Shaping Healthcare in Europe. Right now, European healthcare is undergoing a digital renaissance driven by AI-powered diagnostics, cloud-based data ecosystems, and patient-centric remote care. By emphasizing security, effectiveness, and accessibility, these developments put Europe at the forefront of cutting-edge medical solutions. In this video, we will show you the top 5 technology trends currently shaping the future of healthcare in Europe. Number 5. Private cloud-based electronic health records. The adoption of private cloud-based EHRs is transforming the administration of healthcare data throughout Europe by resolving long-standing issues with scalability, security, interoperability, and regulatory compliance. Many European healthcare providers formerly used disjointed, on-premises EHR systems, which were expensive to operate, challenging to connect across various care environments, and susceptible to data breaches or loss. The General Data Protection Regulation of the European Union, which places stringent restrictions on patient data privacy, consent, and cross-border data movement, is in compliance with the dedicated, secure, and adaptable environment that private cloud solutions provide. Healthcare firms can greatly reduce the risk of unauthorized access or cyber attacks by utilizing private cloud infrastructure, which gives them fine-grained control over data access permissions, encryption standards, and audit trails. Additionally, by using established APIs and data formats, private clouds facilitate smooth interoperability, enabling real-time patient information sharing between various healthcare organizations, including hospitals, primary care clinics, pharmacies, and labs. This connectivity facilitates integrated care pathways, minimizes unnecessary diagnostic testing, and speeds up clinical decision-making by giving doctors access to thorough current patient histories. Without requiring expensive hardware updates, cloud platform scalability also allows for the exponential increase of healthcare data, which is being driven by advancements in wearable health devices, genomics, and medical imaging. Moreover, private cloud EHRs make it easier to integrate cutting-edge technologies like telemedicine, artificial intelligence, and big data analytics, resulting in a strong digital ecosystem that supports population health management, distant care, and personalized medicine. Number 4. AI-driven clinical intelligence. Artificial intelligence is rapidly becoming a transformative force in European healthcare, fundamentally reshaping clinical intelligence by enhancing diagnostic accuracy, personalizing treatment, optimizing workflows, and accelerating research. Artificial intelligence technologies, specifically machine learning, deep learning, and natural language processing, can analyze large, complicated data sets such as pathology slides, medical images, genomic sequences, electronic health records, and even unstructured clinical notes to find subtle patterns and correlations that human clinicians frequently miss. For instance, radiology technologies driven by AI can detect neurological diseases, cardiovascular anomalies, or early-stage tumors with amazing accuracy, allowing for earlier intervention and a better prognosis. AI algorithms are extending the precision medicine paradigm by integrating multidimensional patient data beyond diagnostics to create individualized treatment regimens based on a patient's genetic composition, comorbidities, lifestyle, and response to prior medicines. The European Medicines Agency and the European Commission are actively working to establish frameworks for the safe, effective, and responsible deployment of AI in healthcare. AI also reduces administrative burdens by automating repetitive tasks like patient triage, appointment scheduling, clinical documentation, and coding, which helps alleviate clinician burnout and allows healthcare professionals to focus more on direct patient care. AI-powered predictive analytics forecast patient outcomes, hospital admission rates, and resource utilization, enabling healthcare systems to proactively manage capacity and improve operational efficiency. European research institutions, startups, and healthcare providers are working together to develop AI solutions that adhere to ethical standards, transparency, and explainability. ensuring that AI supports clinical decision-making rather than replaces human judgment. Number 3. Remote patient monitoring and digital therapeutics. Digital therapeutics and remote patient monitoring are revolutionizing healthcare delivery in Europe by providing ongoing, real-time patient care outside of conventional clinical settings, especially for behavioral health and the management of chronic diseases. In order to gather physiological data from patients in their homes or other regular settings, RPM uses a range of linked medical equipment, including wearable sensors, smartwatches. Secure transmission of this continuous flow of health data to medical professionals enables prompt intervention, early clinical deterioration identification, and individualized treatment plan modifications without the need for hospital stays. RPM has been particularly helpful in the treatment of common chronic diseases like diabetes, heart failure, hypertension, and chronic obstructive pulmonary disease, which together place a heavy load on European healthcare systems. RPM helps save money and enhances patients' independence and quality of life by decreasing hospital stays, ER visits, and duration of stay. In addition to RPM, digital therapies provide software-driven, evidence-based interventions that focus on particular medical diseases through lifestyle coaching, medication adherence support, behavioral modification, and cognitive behavioral therapy. These digital treatments, which target issues ranging from mental health illnesses to obesity and smoking cessation, frequently include interactive components, gamification, and tailored feedback to actively include patients in their care. By emphasizing the necessity for remote treatment solutions that reduce infection risks and preserve continuity of care, the COVID-19 pandemic hastened the introduction of RPM and digital therapies. Number 2. Cybersecurity in a hyper-connected ecosystem. Rapid digital transformation of European healthcare systems has resulted in an exponential growth in the volume and sensitivity of health data flowing through cloud platforms, telemedicine services, interconnected networks, and Internet of Medical Things devices, making the cybersecurity environment complex and vulnerable. The wealth of healthcare data, which includes financial information, medical histories, and personal identifiers, makes it one of the most sought-after and valuable commodities for cybercriminals. This data may be used for ransomware attacks, identity theft, and insurance fraud. Recent high-profile cyber attacks on hospitals in Europe have highlighted the disastrous effects of poor cybersecurity, such as weakened public trust, endangered patient safety, and operational disruptions. Healthcare companies are using comprehensive, multi-layered cybersecurity policies that include best practices and modern technologies to mitigate these threats. By constantly confirming each person, device, and access request before giving permissions, zero-trust architecture is becoming more and more popular as a security architecture that eradicates implicit trust, lowering the attack surface and restricting lateral movement within networks. In order to quickly identify and mitigate cyber attacks, advanced threat detection and response systems use artificial intelligence and machine learning to monitor network traffic, user activity, and system anomalies in real time. Strong encryption techniques guarantee confidentiality and integrity even in the event that data is intercepted or exfiltrated, protecting data while it is in transit and at rest. In order to reduce human error, which is still a major vulnerability, healthcare providers are also making large investments in cybersecurity awareness training and incident response readiness. Number 1. Big data analytics in public health and policy. Big data analytics is becoming a potent instrument for revolutionizing healthcare policymaking and public health management throughout Europe by facilitating evidence-based interventions, predictive modeling, and data-driven insights at the population level. Electronic health records, laboratory information systems, wearable medical technology, environmental sensors, social media, and demographic databases are just a few of the many sources of the vast amounts of data that public health organizations and healthcare systems create and gather. In order to find patterns, correlations, and causal links that help guide disease surveillance, health risk assessment, and resource allocation. Advanced analytics platforms combine and evaluate these diverse data sets. Big data analytics proved its potential for quick public health action during the COVID-19 pandemic by being essential in tracking variations, assessing the success of containment efforts, increasing vaccination campaigns, and monitoring infection rates in real time. With the aid of predictive models based on big data, policymakers may better plan for emergencies, increase emergency preparation, and strengthen the resilience of the health system by anticipating future healthcare demands, hospital admissions, and disease outbreaks. Adopting these trends not only improves patient outcomes, but also opens the door to a future in healthcare that is more intelligent, effective, and inclusive throughout the continent. Thanks for watching our video, and don't forget to subscribe.